About 1.5 years have passed down the line from leaving MAMC Dermatology to getting admission in MCK Dermatology and completing over 1 year of residency. From being an unrecognized person to getting my name printed in the Times of India, it has been a long journey and it is very much difficult to summarize. But I would summarize this 1.5 years of my journey in this video. So let's get started. Leaving a top branded institute like MAMC, which has no bond, was a very much difficult call. And as I had explained in that video, that the decision was taken by my father only. So leaving that, returning to Kolkata from Delhi, and I opted for free exit. That time I didn't know that whether I am going to get any seat in the third round or not. But luckily, most of the state colleges dermatology was vacant, either clear vacancy or virtual vacancy. At that time, I was confused between MCK and RGKR. That time I took MCK, though RGKR was a bit better than MCK in case of dermatology. But now I feel that I had taken the good call only for definite reasons. But even after joining MCK and getting dermatology in my UG college, I was going through a mental breakdown which I never shared on the internet. Like I was coming from the gym and my mind was only saying that you are a loser, you are a loser, you left MAMC, you left MAMC. Like this, I had a terrible time, 1 month of terrible time. I took 1 month to settle and come back to normalcy. And my HOD sir was very much considerate that he allowed me a gap of 1 month. After that, I joined MCK Dermatology. Even after joining, I was not clear that whether I would be satisfied with my choice of getting admission into MCK or not. But after 1 week, one CME happened, and there I had exposure to all the top faculties of the private hospitals like Apollo, Wisdom. So the CME was so much interactive and they do so much high on investigations like quantiferon TB gold for a patient. That explained that in the private sectors, maybe better investigations are done than the aims also. So from the first year itself, I was getting exposure to top clinical practitioners also that maybe in other state I wouldn't have got. So that really made me feel great. After that also I had got opportunity to do Botox fillers and PRP from top plastic surgeon of Kolkata. So that exposure also mattered and helped me in gaining confidence and being satisfied. Coming to dermatology as a field, I was sure from my third prof part 1 that I am going to take dermatology because I had the inclination towards dermatology. It had the work life balance and also it has the clinics, and the branch is very much visual and I could recognize patterns better. I feel that I could recognize visual patterns better. So that's why I always had the fascination for dermatology. So in that I had no other option. Like when I left MAMC, there also one radiology seat was vacant and it didn't have that much of duty hours. But I was fixed that I am going to take dermatology only. So in the beginning time, it took me 1 to 3 months to get to diagnose all the basic 80% of the diseases. After that, I could have diagnosed the 80% of diseases and could treat them also. And many rare syndromes also I had seen that I had read on textbooks like the Darius syndrome, the congenital erythropoietic porphyria, that is also called the vampire's disease because it has erythrodontia, that is redness of teeth, like the vampire is sucking blood. And the people cannot go out in sunlight because of the UV exposure. The protoporphyrins absorb the UV light and they react to form blisters. So it is also called a vampire's disease. And xeroderma pigmentosa also I diagnosed without any help by just seeing the patient, the classic textbook example of the salt paper pigmentation, and SCC was also developing. So like that, many rare syndromes also I had encountered, though not much. Much of the patient load is still based on tinea only, tinea corporis, because this is a tropical climate. So even in the winters, about 30 to 40% patients are of tinea only, and after that, most common is the dermatitis group, I would say. One good thing about the West Bengal government is that many medicines are supplied for free, which is not supplied in other states, like the tofacitinib, the monoclonal antibodies like the infliximab, secukinumab, rituximab we get for free, and we can see their response in the patients. Like secukinumab has an amazing response. Amazing means if you give it in a chronic plaque psoriasis, a resistant recalcitrant psoriasis, then it shows massive improvement. So we could see response to the patients for educational purpose only and research purpose. And many think that dermatology does not have that much of indoor, or dermatology has no deaths. That is completely misinformation, because we handle with severe cases like the pemphigus vulgaris, which could have secondary infection that could lead to septicemia and eventually leading to death. Toxic epidermolysis necrosis, so that has about 30 to 40% of mortality. So those patients also we treat, and in our year the mortality was much lesser. 2 to 3 cases there was mortality because there was an associated septicemia and a medical condition associated, maybe renal failure and all. Pure dermatology cases we had only 4 mortality in the year, which is very much less, I would say. Dermatology has a hang of 3 subjects, that is the medicine, pathology, that is the histopathology, and the surgery. So in surgery, the minor procedures that I learned is that intralesional steroids, radiofrequency ablation, electrodissection, iontophoresis for hyperhidrosis, platelet rich plasma, Botox, punch biopsy, NDAG laser, intensive pulse light therapy, phototherapy. These all minor procedures I have learned. I am yet to learn many other procedures like the punch grafting, blister grafting for vitiligo surgery, and the lateral nail plate resections, and I am eager to learn them in future. Coming to the ugly part of dermatology, maybe in MCK, so that is we get only pennies. That is 50,000 is my stipend for first year, and it is a bit increased in second year, but we are literally getting pennies only. Moreover, there is a 3 years bond. That is a major issue for me. If there was no bond, I would have taken in Kolkata only first. So 1 year is in medical college, that is okay, but 2 years of district service bond is there, so it is a headache, and I really don't like that kind of bond actually. Though there are some advantages, but means if you go into the bond posting there, you would have a good patient pool. But I don't want to go away from Kolkata actually. So depends on future, and future is still uncertain. And coming to the ugly part of dermatology is that the patient pool is very much less. Okay, the patient pool is very much less, and people don't get that much of patients. I am being frank with you, being frank, that in radiology you can earn 3 to 4 lakh just after passing out your post graduation. But in dermatology, in case of dermatology, to get 3 to 4 lakhs, it would take you 3 to 5 years at least. In the first, patients don't really come because the quackery is so much prevalent. People go to the quack doctors and the medicine doctors. Mainly the quack doctors prescribe steroids for melasma, and I see so many patients that a horrible looking face, that is called topical steroid dependent faces. Hair is growing out, acne is growing out, and this is a major concern in the rural area, that they are not going to the dermatologist, they are going to the quacks. And even in tinea also they are applying steroids, and it is giving rise to tinea incognito, which is very much difficult to diagnose also. So these are major concerns. And moreover, the Instagram influencers are promoting any brands and all, so that is also taking a lot of patient pool, because everyone knows that in cosmetics it is very much high demanding, it has a lot of money. Coming to doctors also, many doctors are making videos that which cream you should apply for which condition, so it is leading to decreasing in patients. Maybe I would also make, because these videos are going popular in future. And there is no clear demarcation that who can do which cosmetic surgeries. Like ENT people are also doing botox fillers, plastic surgeon they are authorized to do, they are doing botox fillers, even the dentists are also doing hair transplant. So in India there is a lot of gray zone, and this is leading to the decrease in the patient pool. So don't think that you would earn a lot of money being a dermatologist. Yes, people earn top 5% maybe are earning very much great, but many others are not earning that much of great. In many career guidance sessions or the stream guidance sessions, top faculties used to say that I haven't seen any dermatologist who is unsatisfied. But actually, I have seen, because patient pool is a bit less to them. So, about 20 to 30% are not that much satisfied. Maybe not due to the stream of dermatology, but maybe due to the earning potential. Few are also not that much satisfied, also. So, it happens in all branches. I am telling you the raw truth. No one else is going to tell you this. In the end, I would say as a dermatology, it has good work-life balance, not in all hospitals. In few state hospitals, it has a good work-life balance, and I also wanted that only. I wanted that after my 9 to 5 or 9 to 4 job, I would have free time to explore my hobbies, my hobby of being on the YouTube and giving you all advice, and my side hustles, going to the gym, and I am able to pursue that all. So I am satisfied in that aspect. And if you think that I am regretting not taking radiology, then that's not true, because I always wanted a clinical branch, and during my practice I have had some great experiences that were patients not treated by other doctors, but when I treated them, they had a good result. Like there was a kin of my junior who had a severe melasma after peels and all, and after visiting many doctors, she could not get any relief, and doctors also told her to stop all the treatments because it is not going to resolve. But when I started the treatment, it has about 60% of the pigmentation had reduced. So like that, and I am also trying some newer molecules for infections and getting great results. Instead of mupirocin, I use some newer molecules which has very less resistance, and non-healing ulcers and wounds are getting very much good response. So many patients come that I have shown to many doctors, and finally you had treated me and I am getting results from you. So that is a really great compliment that I get, I feel. So I am totally satisfied with dermatology as a stream, because I had it from the beginning only, from third prop part 1 only. The final advice that I am going to give you, that before joining residency, if you ask me that you are a resident of a god forsaken developing country, don't have too much of expectations from this country and from this residency. In few residencies which are very much hectic, basic necessities like bathing, sleeping, brushing teeth, having food on time is a luxury. These basic amenities are a luxury to you. So I would tell that means we have wasted our youth studying the medicine, but during this period we should also enjoy, go for clubs, go for party, go travel with your friends, read books and all, and enjoy this little moments, enjoy during this time period. Don't think it to be a waste, and utilize it so that you could enjoy your life. Okay, like in my example also, if you see, during NEET PG preparation, first 6 months I had gone to many places quizzing and all, and even in taking part in the art competitions. In the last 6 months I didn't take part in art competitions, but I went for quizzing. So I always followed my passion. I always went to the gym and managed gym and NEET PG preparation and internship together. So I may not have got that much of great rank, but at least I have enjoyed my time period. So I would tell you not to have a regret. Enjoy your time period. Okay, your life is precious, and don't take too much overburden yourself, because health is very much important. I had seen a post that a doctor used to take painkillers regularly during her residency, And now when she has a family and a little child, now she developed kidney failure. So she advised that don't take too much of stress, live your life. Okay, don't take too much of stress for your patients. Your life is the most important thing. If you like the video, then do share it with your friends. Then I could make more such videos like this, because in this video I presented the raw myself and the raw facts about dermatology and my life. So you can see the video popping up why I left MAMC and another video popping up. So if you have time, to give it a watch. Take care. All the best. May the gods watch over you.